So in the last video I did, I went over the top 5 reasons why you should not get a Medicare Advantage plan. And in this video, I'm going to do the exact opposite and give you the top 5 reasons why you should get on a Medicare Advantage plan. My name is Brian Monahan. I've been a licensed insurance agent for 15 years discussing Medicare with people just like yourself. So in this video, I'm going to actually compare the two plans so that you can make a decision on whether you want an Advantage plan or whether you don't. Okay, so in this video, I said that I'm going to go over the Medicare Advantage versus the Med Sup. And I said that I'm going to be pro Medicare Advantage, which I'm going to take that, but basically just take a look and see what you think. These are different scenarios. So in the last video I did the scenario of the Med Sup being what you want to get. So let's take it from the first thing. So if we go up here, we see premium. So we'll put that in yellow. So the Med Advantage, a lot of these are PPO plans that have zero premium, meaning you don't pay the company each month for the plan. Now, a lot of people ask, how can that be? It doesn't make any sense. Well, number one, the government gives subsidies for these plans. Basically, they said to the Medicare Advantage plans, whether it be Aetna or Cigna or Blue Cross, they said, hey, we don't want to take care of these Medicare people. We're the government, not a business. So here's the money. You are the professionals, you take care of it. So that's how they do it. So the Med Advantage is $0 a month. Now I took the Med Sup or the medigap, those words are the same thing. Medicare Supplement and medigap are the same thing. If you look at this, $600 a month. Now I have clients and did have clients that were paying $600 a month for their Med Sup. Some people ask, well, how did they get into that, paying that much? Well, the Med Sup plans, you have to apply for the plans. So if you're on a G plan, and when you turn 65, you're automatically allowed in if you're in your initial enrollment period. And then if you have something major happen like cancer or heart attack or a stroke, if your plan keeps raising the rates and you want to go into another plan, a lot of times the other plan will not allow you into the plan. So you have to stay where you are. Well, if they keep raising rates on you and you're unhealthy, you could get to the point where you're paying $600 a month for that plan. So that's what I did. So we're taking that as an example. The last video I did, I put $400 a month. There's a lot of people that are paying $200 a month for their Med Sup, and I wouldn't be so pro Medicare Advantage. So let's now go into hospitalization. Now this is hospital stay. So for the Med Advantage, a lot of the plans that I've seen, and keep in mind, there's different Med Advantage plans, but I'm going over the general, what I have seen with these plans. It costs about $250 per day. Now, a lot of you would say, well, the Med Sup is $0 for hospital, and this is $250 a day. That's a lot of money. Well, keep in mind, it's $250 a day for the first 7 days if you were to stay there. That's only if you stay over at the hospital. So how many months, to get to 600, you'd have to stay, basically 3 days or over 600, 3 days in the hospital each month. But let's go down to what really matters. Let's get to the juicy stuff. So what really matters is this MOOP. That stands for maximum out-of-pocket expense, basically. Let's put this in yellow. So the max out-of-pocket here, for the Med Advantage, a lot of plans that I've seen for 2023, and it'll be a little bit more in 2024, most likely, but the max out-of-pocket is $7,550. This is what you will pay, the max out-of-pocket, meaning if you go to the hospital $250 a day, it has to add up to $7,550. Once you hit that, you're paying $0 for all your other expenses. So that's basically almost like a deductible, and then you pay $0, but it's your max out-of-pocket. Well, with the Med Sup, I put here $7,200 because if it's $600 a month, times that by 12, you're automatically paying $7,200. Now, some people would say, yeah, but you're not paying anything out of pocket. Well, here's where it gets a little interesting. So let's take this out of yellow. Let's put the drug plan in yellow. So the drug plans, a lot of the Medicare Advantage, PPOs and HMOs, they have a drug plan that's attached to it, and you pay $0 for that plan per month. Now, you're still going to pay copays. Let's say you're on, whatever, simvastatin or Lipitor, whatever it may be. The general copay of what you're paying, if you're taking a generic, it might be $5, it might be zero. If you're taking the brand, it could be $50 or even $100 if it's an expensive brand. But to get the plan, it's attached and it's at zero. With the Med Sup, you have to get an additional plan. And the average is about 35, maybe 40 right now. But you have to pay this each month separate to this 600 over here, which equals 7,200. So now take this by 12. Let's make it easy. We'll do it by 10 months. That's 350. So now now we're at the exact amount of the Medicare Advantage, 7,550. So you're paying that out of pocket no matter what. And you say, well, hey, so they're even. Well, let's move on. Let's move on to the vision, dental, and hearing. Let's put that in yellow. So now, vision, dental, and hearing. Med Advantage plans, a lot of them cover it. Zero cost. It's just attached. Once again, you still have a co-payment, but they do have free glasses that you get once a year. A lot of them I've seen. You get $150 towards glasses. Hearing aids, instead of $5,000, they're like $999 per hearing aid. I mean, they have some good deals. Now with a Med Sup, you have to get a separate vision, dental, and hearing, and you're going to pay like $40, maybe more, maybe $60 a month. So you have to add this to your max out of pocket, because this is what you will be paying, $600 plus $35 plus $40. So the $600 now turns into $675 per month, almost $700. So now you're paying more than the maximum out of pocket of $7,550. Now keep in mind the copays for the dental, vision, hearing, and drug plan don't go towards this $7,550, but neither do the ones on the Med Sup. Your drug copays don't go towards, it's extra. You're paying $35 a month, but you still have copays. You're paying $40 a month for dental, vision, hearing, but you go get a crown done, you're going to pay out of pocket. So really what it is the max out of pocket is what you really have to look at. Right here, this row, put it in blue, what you really have to look at and decide, how much am I paying in premiums over here for the Med Sup? Now, from what I've seen, most people would say, well, here's where it really gets itchy. I want to stay in skilled nursing. Let's just say you're paying over here, you're only paying $200 a month. Well, 200 times 12 is $2,400, not $7,200. So if you're paying $2,400 for the year, this is starting to seem, the Med Sup is starting to seem way more attractive than the Med Advantage at this price. But for some people, it's not. They say, you know what? I haven't been in the hospital in 3 years. I'm in good health. I don't take any drugs, and I get a free drug plan. I might wear glasses, and I get that for free. That's great. So even if they go do a CAT scan or MRI once a year, it's $300. You just tack that on to like where the premium would be. And this you're paying per month, and this $300 is only once per year. So some people love the Medicare Advantage because of that reason. They say, you know what? The max out of pocket is $7,550, but I'm already paying that with the Med Sup. So I want to go over here. Even though the skilled nursing, I only get 20 days at a zero cost, and this one I get 100. Well, if I hit this max out of pocket, then it's zero anyway. And they kind of mix and match. So you really have to make a decision on your own which you think is better. And I say the first thing that you do is you look at the premium, but then you look at the max out of pocket and you say, what am I paying with the Med Sup? And if you're in that 500, 600, whatever range, which a lot of times people might be in their 80s or they might be in their late 70s, they have to look at that. Now, the one thing with the Medicare Advantage, you have to make sure your doctors are in network. Where the Med Sup, there are no networks. Anyone who accepts Medicare has to accept the Med Sup. Not true with the Medicare Advantage. Another thing that people tend to forget, and they say, well, I didn't know with the Med Sup, you have to get accepted into the plan. Well, yes, you do. With the Medicare Advantage, you're always accepted. So the one thing that I've shown people is one little loophole that I found, and I kind of like this, but it's a trial right. So if you were never on a Medicare Advantage and you're on a Med Sup, you're paying these high premiums, for 12 months, one time, you can take a look. It's up to 12 months. You can go on a Medicare Advantage, see if you like it. If you don't, switch back to the exact plan that you had, and you're going to pay these high premiums. but switch back to the exact med sup that you had, and no health questions will be asked. You're automatically accepted, but that's only one time. Pardon me. The Medicare Advantage, you're always accepted. So you have to be really careful with that. Make sure that you want the Medicare Advantage if you are going to be spending a lot of money out of pocket and so forth. But here's the thing. I've had people on both of these, and it's really a flip of a coin. People ask me, what is my opinion? Well, I can always give my opinion when this premium is $150, $200, $300. Because I'll say, listen, this is I like these plans way more. You can go wherever you want. You don't have to worry about it. Nobody ever complains about the coverage. But when this starts to get high, this premium, or if they're not going to the doctor or hospital, people start to look at this Med Advantage and say, you know what, I'm saving way more money. Just got off the phone with one of my clients yesterday, and he's like, I'm a little bit nervous, whatever, but he's like, I spent $90 the whole year. He's like, the only thing was my drug plan. Now, here's the thing. You have to get the drug plan. So let's say you're on an Aetna PPO plan. It will give you an Aetna drug plan. And who knows how much those drugs are going to cost. You have to ask your agent, hey, look up my drugs. How much are they going to cost for the year? Because this guy was paying $1,400 out of pocket for the year for his copays with drugs. He said the copay with other drug plans, which you can get whatever drug plan you want on a med sup, they're separate. So if there's 30 different drug plans in your area, you get to choose. With this, with the Med Advantage, you do not get to choose. You have to take, if you have an Aetna Med Advantage, you're going to get the hospital and doctor coverage from Aetna, you're going to get the drug plan coverage from Aetna, and you're going to get the dental, vision, and hearing plan from Aetna. With this Med Sup, you have the Med Sup for your doctor and hospital, outpatient centers, and surgeries and that sort of thing, skilled nursing. But then you get a separate drug plan, so you get to choose whichever you want. You can have an Aetna Med Sup with a Cigna drug plan, and then you can get a separate dental, vision, and hearing. Let's say Humana has the best dental, vision, and hearing. You could have 3 different companies. Some people hate that. Some people like it because they want the choice of getting the best plan for whatever. Some people take a lot of drugs. Some people don't. So if you're not, you get the least expensive plan. Some people need hearing aids soon, so they might want to look at, okay, well, the hearing aid, for this company, it's better, whereas opposed to Aetna, it's really not that great. I'm just giving examples. So that's the bottom line with the Medicare Advantage versus Med Sup. I hope this video helped. My number's in the description box below. Take a look at this other video that I did on why you do not want a Medicare Advantage. I went over some of the pitfalls that I've heard. And make your own decision. If you need any help, you can always call my office. Thanks for watching the video. I'll see you at the next one.